Hello everyone and welcome back to Three Docs Teaching. I'm Dr. Zain and in today's video we're doing another question. So let's go through today's question. A 42-year-old female with a history of migraines presents to the emergency department complaining of severe headache, photophobia, and nausea. She reports taking her usual dose of sumatriptan but failed to achieve relief. The physical exam is remarkable for mild dehydration, and the patient reports several episodes of non-bloody vomiting. The physician suspects sumatriptan-induced nausea and decides to administer metoclopramide. Which of the following is the most likely mechanism by which metoclopramide works in this patient? Our options are agonism at the 5-HT3 receptor, antagonism at D2 receptors, agonism at D1 receptors, and antagonism at muscarinic receptors. So the concept we're going to be covering today is that of vomiting and the basic receptors and areas involved and what drugs will act on which receptors. We're going to do a very basic overview today, and then we'll come back to the question and see if we can solve it using what we've learned. So, as you can see on this page, I've put a few shapes here to sort of give us an idea of what areas we're dealing with. So we have here the area postrema, we have here the nucleus tractus solitarius. Here, as a semicircle, I've made the vestibular system because, ear semicircle, it kind of looks like it. And GI I've made as a circle because, well, your gut kind of is circular on cross section. So we're going to basically look at what's going on here. So the first thing you need to know is that the nucleus tractus solitarius is your vomiting center. So this is the center. Okay? Everything eventually leads back to the nucleus tractus solitarius. The next thing we need to know is that this right here, the area postrema, is also known as the chemoreceptor trigger zone. Okay? So that's what this is. The vestibular system, as we already know, is in the ears, and the GI, we already know, is in the gut, essentially, the bowels and the stomach. So let's go through where exactly different signals are going to come from in order to induce vomiting. So let's start with the GI, because that's what we usually associate vomiting with. If you think of it from someone who's not in medical school's perspective, they're going to consider vomiting to be mostly a GI thing. And it's kind of true. GI is one of the major places where you can have vomiting. So I'm going to just make a line right here connecting GI with the nucleus tractus solitarius. So the important thing here is to understand which cranial nerve is going to be involved here. This is going to be the cranial nerve 10. The vagus nerve. Okay, this is very high yield. The vagus nerve takes afferent supply from the GI to the nucleus tractus solitarius. Okay, and now the next high yield point here is that the important receptor is 5-HT3. Okay, so it's a serotonin receptor. So serotonin will be released when there is irritation on the GI tract, and it will, stimulate these receptors, and then through cranial nerve 10, the signal will go to the nucleus tractus solitarius, and that will start the vomiting response. So that's a very basic, very simple overview of this. Now, what's important to understand is what drug is going to act here. So we're going to have a drug that's going to antagonize this particular receptor. And this drug is ondansetron. So ondansetron is going to act by antagonizing the 5-HT3 receptor over here. This receptor is on the afferents from the GI, the cranial nerve 10 afferents from the GI all the way to the nucleus tractus solitarius. So if you antagonize this receptor, the signal's not going to go. All right, now let's move on to vestibular system. Now most people can also be familiar with how the vestibular system interacts with the whole vomiting mechanism, because if you think about it, motion sickness is essentially this, right? So you're going to have signals from here also coming to the nucleus tractus solitarius. And I'm sure you've already guessed what cranial nerve this is going to be. This is going to be cranial nerve 8, the vestibulocochlear nerve, vestibular system, vestibulocochlear nerve. It's pretty self-explanatory. So what are the receptors here? There's two receptors that are responsible for this particular signaling. One of them is the H1 receptor and the other is the M1 receptor. Okay? So you have the H1 receptor and the M1. So histamine and muscarinic. All right? And we're going to have certain things that are going to inhibit each of these. All right? So what's going to inhibit the H1 receptor is actually the first generation antihistamine drugs. All right? And examples of these are diphenhydramine and meclizine. I'm not going to write them here because I don't have enough space, but I'm sure you remember. Diphenhydramine and meclizine. As for M1, what's going to inhibit the M1 is a drug called scopolamine. Whoops. Scopolamine. All right, this will inhibit the M1. So now we understand that from the vestibular system, you have two particular mechanisms, the H1 receptors and the M1 receptors, that are going to send signals via cranial nerve 8 to the nucleus tractus solitarius, which is the center, the vomiting center of our body. And if you want to antagonize the H1 receptor, you're going to use first generation antihistamines like diphenhydramine and meclizine. And if you want to antagonize the M1 receptors, you're going to use scopolamine. Now, that brings us to our last area, the area postrema, also known as the chemoreceptor trigger zone. Now, what's important about this one is that the receptor involved is the D2 receptor, dopamine, right? So if we want to inhibit this pathway, we need to inhibit these D2 receptors. And the drug that's going to do that is metoclopramide. All right? And if you remember, that's also one of the reasons that metoclopramide is in fact contraindicated in patients with Parkinson's, because it will mess up the entire dopamine balance. So there we have it. That is a very basic overview of the, let's say, the bones of how the vomiting system works. Quick recap, all right? Our center is the nucleus tractus solitarius. We have three different inputs, all right? The area postrema, which is right adjacent to it actually, so it doesn't need a nerve as such. The vestibular system and the GI. The GI sends its signals via cranial nerve 10. The receptor involved is the 5-HT3 receptor, and it's antagonized by ondansetron. All right? As far as the vestibular system is concerned, it sends its signals via cranial nerve 8, the vestibulocochlear nerve. The receptors involved are H1 and M1. H1 is antagonized by first-generation antihistamines, such as diphenhydramine and meclizine, and the M1 receptor is inhibited or antagonized by scopolamine. So that's your basic overview of vomiting in a nutshell. So now let's go back and take a look at this question again. A 42-year-old female with a history of migraines presented, all right? She was given sumatriptan and she had nausea. Essentially, what's happening here is that to treat that nausea, this patient is given metoclopramide, and the question is asking what is the most likely mechanism. So essentially, if you just strip this question down to its bare bones, it's asking the mechanism of metoclopramide. That is the question. And as we just discussed, metoclopramide acts on the D2 receptors in the area postrema. So the correct answer is B. Thank you for watching. I hope you learned something. If you have any questions or any comments or any suggestions, leave them down in the comments. Hit the like button if you enjoyed, subscribe if you want to see more, and I will see you the next time.